Due to COVID-19, it has been difficult to maintain HIV program performance whilst dealing with the pressing urgency of this unprecedented crisis. It is therefore encouraging to see that additional districts, Herigwala in KwaZulu-Natal, Thabo Mfusanyana in the Free State, have already achieved the 1990 targets at the total population level. During the first 6 months of 2020, I want to congratulate these districts for defying the odds and pushing against the current towards our shared goal. Allow me, program directors, to now elaborate on the government partnership with SANAC and civil society in fighting HIV pandemic. Cheka Impilo and She Conquers are the two major campaigns that we've been driving together in a multi-sectoral manner to bring services closer to the people. We introduced the National Adherence Guidelines for HIV, TB, and NCDs in July to address the linkage to care, adherence or treatment, and retention of cases, particularly that those who have a difficulty, who are difficult to manage. With the issuing of those new clinical guidelines, the National Adherence Guideline had to be revised. The revised standard operating procedure for the guidelines was endorsed in March 2020. In addition, the Department of Health adopted a differentiated model of care as the overreaching terminology for differentiated service delivery. This enables delivery of services across the care cascade, while recognizing the importance of integrated chronic care service provision. The interventions also provide guidance on facility decongestion by referring stable patients for multi-month dispensing 2, 3, or 6 months. Implementation of the Central Chronic Medicines Dispensing Distribution, we call it CCMDD, has enabled the stable patients to collect their treatment for free from a convenient location point near their homes and place of employment. These services came into high demand during the COVID pandemic, highlighting their need, highlighting their utility now and to the future public health care medicine. As of September 2020, the program boasts of 2 million active patients on antiretroviral treatment, referred to differentiated model of care, and over 1.3 million patients using external pickup points, and 1.2 million patients using facility pickup points, and about 300,000 utilizing adherence clubs. This model will enable us to close the treatment gap, especially for the adults. Meanwhile, to address the children treatment gap and 1990 respectively, the metric intervention of standard operating procedure has been developed and approved. We also know that prevention is better than cure. Condoms remain the cornerstone of prevention, and hence the consistent and correct use of male and female condom will reduce HIV and other sexually transmitted infections, as well as unplanned pregnancies. Furthermore, male and female condoms, Max and Maxima, and compatible lubricants are distributed for free in public health facilities and through other organizations and departments. Ukubuyela kancane kulento ebibekwa uDadewethu uSibongile Shabalala ucela inamba sase siyamnika. Kodwa ngicabanga ukuthi kubalulekile ukuthi sibonge ukubambisana phakathi kwabo bonke sisebenza nabo, abasebenzi njengoba kade kukhuluma lapha umongameli kaKhosathu umama uLosi, bese kuba abosomabhizinisi bade kukhuluma obamele sabukhowa, bese kuba inhlangano zomphakathi ezilwa negciwane kanye nezinye izifo. Kubalulekile masiya phambili sikhuluma ngeNational Health Insurance, so sidinga sisebenze eduze kakhulu nenhlangano eziqhamuka emphakathini zabantu abazi leso sifo ekufanele siselaphe, ngoba masiya phambili kufanele bekhona ulwazi esichazela ngalo umphakathi, abantu abakulula ukuthi bakwazi ukusukumela lokho yilabo abavele benaleso sifo, noma ngabe icancer noma ngabe TB, ngoba bakhuluma ngento abayaziyo abaphila nayo. noma sebedlulile kuyo. Nokubaluleka kokuthi kuzoba nezinto enizozibona ekuphethweni komnyango ezizokwenza ukuthi kungasebenzeki ukwelapha leso sifo, kodwa kube nengxaki ngoba akukho la nimeleleka khona. Kubalulekile ukuthi sikuvule lokuthi kusetshenziselwane eduzane. Ngapha sisebenza ngaphansi kweSANEC, kodwa kuze kofika kuma Provincial AIDS Council, kuma District AIDS Council nasemawodini kufanele nibe khona ngoba izwi lenu izwi labantu abazinikele ekutheni leso sifo akuliwe naso. Okubalulekile ukuthi akuthi la kusetshenzwa khona babe nayo imbono ukuthi lokhu nalokhu akusebenzi ngendlela. Umama okhuluma ekuqaleni kulesigaba sabantu abasha uthi ingane zakhe zikhulele kwazi bakabili ethi uyabacelele esibhedlela emaklinikhi ukuthi ababancede ngokuvikela ukuthi bangakhulelwa, uthi uyithuma ingane ukuthi ihambe yoqala ukuyakolala ucansi nabantu besilisa. Kahle hle zonke lezo zinto uma khona bekuchazwa okunye ukuthi kuba khona ukumenyezwa kabi namagama enza abantu bangakhululeki noma bangaphatheki kahle, ukuthi abanegciwana beze ngapha noma le cure abantu abazolanda treatment ye HIV eyenza ukuthi abantu banibuke kube sonke silapha eclinic and siyagula sonke, bese kwenza ukuthi umuntu agcine ebukwa ngesifo engabukwa njengomuntu onesifo njengoba sonke sinazo. Balekile ukuthi le ngxaki yokubandlululwa siyilwe sindawonye. Ngakho ke ngiyakuvuma ukuthi sibambisane eduze na kakhulukazi nazo zonke inhlangano ukuze kugcineni sikwazi ukusheshe sithole ixazululo esingazisebenzisa. And I must say, Deputy President, once again, we're very encouraged with a very positive, constructive engagement attitude of TAC and the other associations, because it makes it all to be one side as we fight a problem. It therefore makes it to be such that we don't have to confront each other, but what we have to do is to take your suggestions and your proposal and fit them into the implementation plans of the departments. Now all the proposals that were put to us yesterday, we've set a team to go and deal with them because they're not your problem. They are the problems of the department, but much more clarified because you have expressed them from a point of view of the clients who use the service. And that's the best way of running the health service, to satisfy you as the clients and give you your own voice in being able to shape the direction of the health services. So we want to say thank you for that, and let's continue in that kind of approach. We also continue to expand pre-exposure prophylaxis in public facilities. This is a pill taken daily orally to prevent acquisition of HIV for everyone at substantial risk of acquiring HIV. In addition, this PrEP and condoms, our public health facilities continue to provide the services for other sexually reproductive health and rights interventions such as contraceptives, antenatal care, termination of pregnancy. And for all men out there, we provide medical male circumcision for free in facilities and selected sites. We know from research that men who are circumcised are less likely to contract HIV by 60%. Does not necessarily render you immune, but it actually reduces the chances of that infection. I also think it's important to also put the final word to the people of South Africa. Anyone who still does not know their HIV status is encouraged to test for HIV and TB. I would also like to challenge you to encourage and call on your sexual partners and friends, family and children to get tested and to support and embrace those who are initiated on treatment. Together, we can reach 1990 targets and eliminate HIV by 2030. It's also important for us to be able to challenge all the social norms that make the younger girls and adolescents to fall prey on older men who are already infected. That is why younger girls get infected, is because of the abuse and the manipulation, economic manipulation by those who are older. Iningi lamantombazana asemancane amatshitshi angaphansi kweminyaka ewu-20-24 bavamise ukuthi ukungenwa kwabo isifo ukhombisa ukuthi abakhuleliswa ontanga yabo, kusho ukuthi abadala abehlela ngakubona. Into le kufanele sisukumele sisebenze ngoba ekugcineni yilapho la kufuna sivale khona ukuthi lesifo singaqhubeki kakhulu.